Hello, this is Dr. Schmidt here, once again talking about functional neurology. Today we're going to go over the foundations of what I would deem as functional neurology and the things that I test here to improve brain neurological body health. So the first one we're looking at is body movements. How well can you move your body? How fast can you move it? How smooth can you move it? But it's every single body part, from hand to shoulder to elbow to neck. If you are moving them inadequately, you could have shoulder pain, neck pain, stuff like that, headaches, anything like that. We're gonna do knees, ankles, all that fun stuff. Next is primitive reflexes. Primitive reflexes are reflexes that help babies be able to do things such as roll over, bring their head up, crawl, and then eventually able to walk. These are things that should be completely integrated at the age of 6 months and sometimes a year. Those are things we'll test. And then next one is balance. When we look at balance, we look at it as in static, which is we're not moving balance, so just standing still, eyes open, eyes closed, maybe one leg, stuff like that. Next thing we're gonna do is do some more dynamic balance, which is moving. So we'll have you like walk the line or stand on one leg and move your arms and stuff like that, maybe move your head. We're looking to see how well you can do that without losing balance. The next one is vestibular eye movements. And with that one, once again, we're gonna have you track our thumb up, down, left, right, and we'll have you move your head, looking to see if there's any neck involvement with those areas. And once again, we're comparing you to what would be optimal, where you should be. And if you're not there, that's when we start improving those areas to make them work the way they should. Any various symptoms could involve any one of these, but the test is what's going to show what is abnormal that can bring out certain symptoms. So it's all about the testing, the exam, and finding out what you can and cannot do appropriately and fixing that, and that tends to take care of any symptoms and stuff like that. But if you're doing all this and you're eating like crap, whatever you eat, that's what your cells are made up of. You eat crap, your cells turn into crap because they're constantly replacing themselves. So that, along with adequate nutrition, will help you better able to do problem solving, math, memory, and stuff like that. It'll help that a whole bunch. The next thing that it'll help also is your mind. That's like your positive outlook on life, your self-talk and stuff like that. Yeah, so this is the foundation of what we kind of test here at my office, and whenever we find a abnormal finding, we work on fixing it, and that's what we'll probably dive into next, is kind of breaking all these little tiers down and going over specific exam items that we like to do, and then potential treatment and therapies off of that to improve those findings and make your brain and body and neurological system healthier. See you next time.